Panic, desperation, destruction. The war in Gaza has been going on for more than 100 days now, with millions of people forced to flee their homes and displaced residents facing the threat of disease and famine. The medical staff and responders have witnessed harrowing moments as access to healthcare becomes increasingly difficult. Well, joining us now from Sydney, Australia is Paul McPhun. He's the Director of Southeast Asia and the Pacific at medical humanitarian organizations Doctors Without Borders. Good morning, Paul, and thank you for joining us.
Good morning, Paolo. Thank you.
Paul, your team has been on the ground providing medical and humanitarian assistance to those affected. Based on your data, how many casualties are we looking at since the chaos erupted in October?
Well, the general estimations, go beyond our capacity to make, but we're talking in the region of about 60,000 people now wounded, 25,000 or more killed. Within that, over 10,000 children killed. That's also on the backdrop of a population of about 1.9 million people who've been forcibly displaced. That's 85% of the entire population in Gaza. So the impact is absolutely massive. And to translate that to where we provide care in just one hospital in the south of Gaza, we've just received orders that this region has to be evacuated in Khan Yunis. We have 850 inpatients in a hospital that was designed to manage less than 200, plus thousands of people taking shelter. So yeah, the numbers are indescribable. The suffering, it can no longer be put into words.
Right. It truly is a harrowing situation. What are the most common injuries that the MSF personnel have seen, and we've reported that most of or many of the casualties are actually women and children. What kind of injuries has the MSF most commonly seen?
Yeah, over 60% of the patients that we treat are indeed women and children, and that's because this is a context where there's nowhere to go and there's nowhere that's safe. That means everybody is being indiscriminately under attack, and the impact we see in medical terms is such that there's a huge burden of injuries among women and children, which is quite unique in this theater of war in our experience. And we're seeing everything that you see in any classic war context: burns, a significant number of people coming with burns, crush injuries from falling buildings, debris, etc., fractures, crushed limbs, gunshot wounds, munition wounds. And then we're seeing a huge amount of people with infections. So they've suffered injuries and wounds that haven't been treated. Now they're getting infected. And these are really high-risk problems to have in these kinds of densely packed settings where there's no water or easy access to water, sanitation, hygiene, etc.
Paul, you pointed out that the reality is there really is nowhere to go, but what do you know of the situation in displacement camps? What's the situation there? What are the most common illnesses that people can get in, like you said, these very dense displacement camps where water and basic food and other and shelter is in short supply?
Yeah, it's hard to describe this setting. Of that 1.9 million people, approximately half of them are in the south. Many of them are living in the most indescribably poor conditions, just basic plastic, basic bits of timber, anything anybody can scavenge and find. And this is in bitterly cold conditions. Then there's no easy access to water, there's no easy access to sanitation. Food is a massive problem, and the UN has estimated that 40% of the population are at risk of famine. All of these factors, are high risk, drive high risk of the spread of infectious disease, and we're seeing clearly a huge number of respiratory tract infections. That's very, very dangerous among children. Diarrheal disease is very, very common. Again, very, very dangerous, particularly for people that are not accessing food and water. We're seeing a high burden now of malnutrition among children, but as I said, in a population that has no access to food, basic, being able to maintain your basic health and living conditions is just completely compromised. So we're seeing, the full remit of problems that you would expect. But on top of that, exacerbated and made massively worse by the ongoing conflict. Nowhere is safe. The siege, it's very, very difficult to get anything in. And the indiscriminate attacks on healthcare facilities and health personnel. So, really limiting people's access for care.
Paul, aside from the medical aspect, the war between Israel and Hamas is also affecting the emotional and psychological well-being of the people for obvious reasons. Tell us about the psychological impact of the war and what Doctors Without Borders can do in terms of interventions to help address this.
Yeah, I mean, in any crisis, of course, there's always a huge impact on people's mental well-being, not just their physical well-being. And often we see that manifested in physical ways. Really here we're seeing the burden being borne mostly by children. They just don't understand what's going on. It's a world that they can't grasp. The conditions they're living in are appalling. Nobody's child should have to endure what these children are going through. The things that they have witnessed, they cannot cope with, they can't compute. So that's where our primary focus is currently. The majority of the population is still in this mass state of shock. Every day is literally about survival. It's about trying to stay safe, trying to provide for yourself and your family, moving constantly, scavenging. And in those kinds of conditions, the impact, the mental burden, it's just accumulating. And we'll see the impact of that, and it will be absolutely massive at some point in time. But at the moment, among the adult population, that they're essentially so focused on trying to survive and provide for their families that reaching them with mental health care at this point is quite challenging. So, yeah, most of the burden that we face today and most of what we're trying to address our services towards is among children.
Well, it really is hard to imagine what people are going through out there, and it's hard to think about where to start. But we thank you for the work that you guys are doing out there. Thank you once again, Paul, for joining us here on New Day.